Good evening. My name is Joanna Faunce, and I research transportation networking companies and their effectiveness as a solution for non-emergency medical transportation. Each year, more than 3.6 million people in the United States are challenged with transportation barriers in getting to their healthcare appointments. Many patients are underinsured and lack transportation options. Further, traditional NEMT services can be costly, and there has been a decrease in resources and support for these services in recent years. Hospitals and healthcare organizations seek solutions to reduce these barriers, and TNCs are being considered as a solution. Safety, reliability, and cost effectiveness are primary goals of healthcare organizations when selecting transportation vendors. These were used to evaluate the effectiveness of TNCs in this role. Safety. We've all heard horror stories involving passenger or driver assaults and other rideshare incidents. TNCs have different regulations than traditional NEMTs. There's lack of consistency with driver background checks and limited transparency regarding safety incidents. On a positive note, TNCs such as Uber and Lyft have taken strides to improve safety measures in recent years. To name a few, they're improving background checks, rides can be tracked or even live streamed, and a distress alert button has been added to the user application. Reliability. 25 to 50% of missed healthcare appointments are due to transportation barriers. Additionally, prolonged wait times or unfulfilled trips place increased stress on patients and hospital staff. With TNCs, there are time of day variances with driver availability and limited resources in rural areas. And although wheelchair accessible vehicles are a ride type option with Lyft and Uber, they aren't necessarily available when needed. However, the flexibility of TNCs with both on-demand and pre-booking capabilities helps streamline the patient discharge process, making hospital beds available to other patients. In a pilot study, CareMore Health System partnered with Lyft to provide transportation for their patients, and wait times were reduced by 30 minutes on average. Finally, cost effectiveness. TNCs can provide significant cost savings. CareMore Health System reports their partnership with Lyft reduced their organization's trip costs by 1/3. Other sources report up to 70% savings. Overall, TNCs are effective as a supplemental solution for ambulatory passengers. With the passenger majority able to walk, TNCs prove to be a significant cost-effective option compared to traditional NEMT services. Traditional services, however, should continue to be available for those relying on wheelchairs, gurneys, or other mobility devices that don't fit in a standard vehicle. With the continuation of improved safety measures, I recommend pre-employment drug screening, greater consistency with background checks, and DMV pull notice program participation requirement for drivers. Thank you for your time. Please let me know if you have any questions.